Have you ever woken up in the middle of the night with your heart racing or drenched in sweat? You might think it's just a bad dream, but what if it's actually a silent sign of something far more serious? Millions of people with type 2 diabetes are experiencing nighttime symptoms, and they don't even know it. And ignoring them could lead to nerve damage, heart complications, or even losing your eyesight. That's why this video might be the most important one you watch this year. Because today, I'm going to reveal the 15 most dangerous diabetes symptoms that only show up at night. And trust me, some of them are so subtle, you'd never expect them to be linked to diabetes. But here's the catch. We're saving the most critical warning signs for the end, because they're the ones most people miss until it's too late. So stay with me, and I promise you'll walk away with the knowledge to protect yourself and your loved ones before it's too late. Let's begin. If you frequently wake up gasping for air, struggling to breathe, or feel like your chest is tight, it could be more than just anxiety or sleep apnea. Diabetes can affect your respiratory system and even your heart rate while you sleep. High blood sugar levels cause inflammation that puts pressure on your lungs and arteries. And when that happens, your body panics, triggering those middle-of-the-night gasps for air. Now let's talk about nighttime sweating. We're not just talking about warm nights or too many blankets. We're talking about waking up with your sheets soaked, your pajamas drenched, and your heart pounding. This could be a sign of low blood sugar, also called nocturnal hypoglycemia. It happens when your glucose levels drop too low during sleep, and your body responds by releasing adrenaline, which causes the sweating, restlessness, and heart palpitations. It's not just uncomfortable, it can be dangerous. If your blood sugar gets too low for too long, your brain may not get enough glucose to function properly, and that can lead to confusion, fainting, or even coma. Now imagine this. You get up at night to use the bathroom. Not once, not twice, but maybe 4 or 5 times. You feel like your bladder is always full. And even after urinating, you still don't feel relieved. This could be a sign of high blood sugar overwhelming your kidneys. Your body is desperately trying to flush out the excess glucose by making you urinate more often. The problem? You're also losing precious fluids and electrolytes, which can make you feel dizzy, weak, or even dehydrated the next morning. And here's something even more alarming. Frequent urination at night is also a risk factor for kidney damage, especially in diabetics who don't realize their blood sugar is out of control. Now let's talk about dry mouth. It might sound harmless, but waking up several times a night with your mouth feeling like sandpaper? That's your body crying out for help. High blood sugar dehydrates your tissues, including your mouth and throat, and this can lead to gum disease, tooth decay, and increased bacterial growth while you sleep. Ever woken up with strange leg cramps that seem to come out of nowhere? These sharp, painful spasms, often in your calves, might be a sign of diabetic neuropathy. That's nerve damage caused by chronically high blood sugar levels. And guess when it tends to get worse? At night, when your body is resting and circulation slows down. These cramps aren't just annoying, they're a sign your nerves are struggling to function properly. If left untreated, diabetic neuropathy can cause permanent numbness, burning pain, or even muscle loss. And while we're on the topic of nerves, let's talk about restless legs. Do you ever feel like your legs are buzzing, tingling, or twitching when you lie down? Like you just can't get comfortable no matter what? Restless leg syndrome is far more common in people with type 2 diabetes. It's often triggered by nerve damage and iron deficiency, both of which are linked to unstable blood sugar levels. This constant urge to move your legs may seem minor, but over time, it can seriously disrupt your sleep and worsen insulin resistance. Now, have you ever experienced nightmares or vivid dreams that feel unsettling or intense? It might not just be your imagination. When your blood sugar drops too low at night, it can affect your brain chemistry. This leads to abnormal REM sleep patterns, and yes, more intense and frightening dreams. These nightmares are actually warning signs from your body. It's trying to tell you that your glucose levels are dipping into dangerous territory. If this happens regularly, it's time to take a closer look at your bedtime habits, your dinner, and your medication timing. But what if you're not dreaming at all? What if you're lying awake for hours, just staring at the ceiling? Insomnia is another overlooked symptom of diabetes. Blood sugar imbalances affect your ability to produce melatonin, the hormone that helps you fall asleep. They also trigger cortisol spikes, which make your brain feel alert even when it should be winding down. And when you don't sleep, your body becomes more insulin resistant. So insomnia actually fuels a vicious cycle: poor sleep, higher blood sugar, even worse sleep. Symptom number 4 is cold sweats during the night. You wake up drenched, confused, maybe even trembling. This isn't just a bad dream. It's a possible sign of nocturnal hypoglycemia, when your blood sugar drops dangerously low while you sleep. And the worst part? You might not even know it's happening. Your body goes into panic mode, releasing stress hormones to save you. But over time, this constant stress damages your heart, your nerves, and your sleep quality. If you've ever woken up soaked in sweat without any clear reason, don't ignore it. It's your body screaming for help. Symptom 5 is frequent urination at night. Needing to pee once, may be normal. But 2, 3, even 4 times a night? That's not normal. It's called nocturia. And in people with diabetes or prediabetes, it often means your blood sugar is too high. Your kidneys are trying to flush out the excess glucose, but in doing so, they disrupt your sleep, dehydrate you, and weaken your immune system. Waking up tired, groggy, and constantly running to the bathroom isn't just annoying, it's a red flag. And the more often it happens, the more serious it may be. Let's move on to symptom 6. Intense thirst after midnight. You drink water before bed, yet still, you wake up with a dry mouth, desperate for another glass. It feels like you haven't drunk anything in days. That extreme thirst is called polydipsia. It's a classic sign of high blood sugar and poor glucose control. Your body is trying to dilute the sugar in your bloodstream by demanding more water. But no matter how much you drink, you still feel parched. This isn't hydration, it's a warning. And now, symptom number 7, restless legs or burning feet in bed. You lie down, hoping for peace, but your legs twitch, tingle, or even feel like they're on fire. It's not just discomfort, it could be diabetic neuropathy starting to develop. When nerves begin to suffer due to years of unstable blood sugar, the first place you'll notice is your legs and feet. This can start subtly, but it can grow into chronic pain, numbness, or even loss of sensation. If your nights are filled with leg spasms, tingling, or burning, take it seriously. Symptom number 8 is sudden nighttime hunger. You go to bed full. Yet at 2 or 3 in the morning, your stomach growls like you haven't eaten in days. You feel shaky, irritable, desperate for food. This can be another sign of unstable blood sugar, especially if it swings low during the night. Your body is crying out for glucose, trying to rebalance itself, and if you grab the wrong snack, you'll spike and crash all over again. It becomes a vicious cycle that ruins your sleep and your metabolism. If this happens more than once a week, it's time to take a closer look. Symptom number 9 is irregular heartbeats while lying down. You're trying to relax, but your heart suddenly skips a beat, or it races out of nowhere, like a drum pounding in your chest. This could be due to blood sugar spikes, crashes, or electrolyte imbalances. And when these heart flutters hit you during the night, they can trigger anxiety and panic. Many people ignore this symptom, thinking it's just stress or bad dreams. But it can be a red flag for cardiovascular complications tied to poor glucose control. Your heart is trying to send you a message. Don't silence it. Let me ask you something. Have you experienced any of these signs recently? Or maybe a loved one has mentioned one of these symptoms in passing? Even if they seem small or harmless, they might be the early whispers of something more serious. You don't have to wait for a diagnosis to take action. Awareness is your first line of defense, and by understanding these signs now, you can prevent long-term damage later. In the final part of this video, I'll show you exactly what to do if you've noticed one or more of these signs. Simple, natural strategies backed by science. No gimmicks, No fear tactics, just real answers that work. So keep watching. If you've made it this far, you're not just curious. You care about your health. You want answers. And you want control. That's why you deserve to know this. These nighttime symptoms aren't just random. They're messages. Messages from your body asking for help before things get worse. The good news? It's not too late. Thousands of people have reversed their nighttime symptoms naturally. They've improved their sleep, stabilized their blood sugar, and regained their energy without medications or extreme diets. You can be one of them. Right now, there's a simple way to begin. Click the link in the description below and discover how others are lowering their blood sugar safely, step by step. It's the same method used by thousands. And it might just change your life too. Don't ignore the signs. Don't wait for a diagnosis. And don't try to figure it out alone. Take the next step. If this video helped you, please like it. Comment below with your experience or questions, and subscribe for more weekly content on reversing diabetes, controlling blood sugar, and living fully again.